Should patients be able to refuse treatment by doctors of some races or ethnicities? So the first question is, why does this specifically happen? Why do people seem to choose certain doctors and deny others? So there are four reasons that can pertain to this. One of the reasons is cultural and personal beliefs. A second is past experiences. A third is trust. And the fourth reason is language and communication. So starting with cultural and personal beliefs, some patients have beliefs that influence their preferences of providers. For example, many Muslim women will request female providers or specifically Muslim providers because they know they share an understanding in language, belief, experiences, or cultural practices. Also, some studies have shown that patients have chosen providers that have the same race or ethnicity as them all the time, and they prefer them as well. And this is a phenomenon known as the racial concordance. So, for the second reason, past experiences. Sometimes historical or past experiences of discrimination or mistreatment can lead to distrust. For example, many people know the case of Henrietta Lacks, where her cells were sampled without her knowledge and she wasn't even given adequate care before she died. Situations such as these can often lead people to think that the same thing will happen to them. So, therefore, a lot of people feel a lot more comfortable to go with people that are their same ethnicity or race because in Henrietta Lacks' situation, for example, she was in a predominantly white hospital and she was treated this way. And statistics have shown that at least 55% of Black Americans have had at least one of 6 negative experiences with a provider that wasn't their same ethnicity or race, and that another 49% of African Americans feel that they have worse health outcomes because they can't get advanced medical treatment from certain providers. So, situations with discrimination like this and just historical factors have often led people to be a lot more distrustful of certain providers and more trustful with others. So, talking about distrust, now another reason goes into trust. So, trust between a patient and a healthcare provider is a key factor in treatment and outcomes. Patients might feel more comfortable with a provider they believe they can relate to. For example, Black providers make up 4% of the system, but they care for more than 20% of African Americans in the United States. Many may choose a provider of the same ethnicity or race because they instill a lot more trust into them. And the last reason, language and communication. Language barriers can also play a role because if a doctor doesn't speak a patient's language or have some type of fluency, the patient will oftentimes feel misunderstood or uncomfortable because they feel like they're not properly being heard. So, moving on, you have a lot of reasons why these type of situations may happen, but there are a lot of people who also think that patients should not be able to refuse treatment by certain doctors, and these are a few reasons why. So one of the reasons is stereotypes and implicit bias. This can lead patients to form perceptions of doctors based on societal stereotypes, which may result in them being unwilling to accept care from these professionals regardless of their qualifications. This can often cause insufficient evaluations, especially because providers won't be able to provide healthcare properly, and therefore this makes treatment a lot more difficult, and it isn't fair to the patients or providers, which is why many people feel patients shouldn't be able to have a choice like that. Another reason is missed opportunities and the reinforcement of stereotypes. When this occurs, patients may make decisions based on a physician's race, which can be harmful and reinforce racial biases within the system that a lot of people in the system have been fighting to get rid of. It also prevents patients from experiencing the benefits of a diverse healthcare environment. For example, Dr. Angela Rowe, a non white provider, had a situation where a white mother forbade her from touching her daughter due to her race. This is harmful in nature because it limits the daughter in the healthcare that she can receive while also shaming the provider solely due to her race. Behavior like this makes patients feel justified in their actions, and it also leads to a cycle that a lot of people in the system have fought to get rid of, where a lot of patients will feel they can be prejudiced under this kind of system, and providers may react to that prejudice, leading to inadequate care. And this makes a lot of people feel that people are just better off not being able to choose who their providers are, because it just leads to a lot less problems and it promotes diversity, which is what a lot of people want in a healthcare environment. But despite these ideas, people are entitled to their own medical autonomy. There are many reasons why people should be able to choose their own providers, even if it is based off race. These reasons benefit the health outcomes of these patients. So these type of reasons could be the fact that medicine is all about choice and decisions. Medicine and health outcomes depends on decisions. Sometimes important choices can't be made solely by the provider, but instead by the provider and the patient, which is why the relationship between them is very important. If the patient doesn't feel comfortable or supported by their provider, the ability to make a difficult decision, if it comes, will be harder, and it will put the patient at a higher risk. The decision needs to be made in accordance with the patient's values and beliefs. And if the patient feels that they cannot relate to their own provider, the best decision may not be made for them, because if the values don't seem to align, they might feel better off choosing a provider that they feel like will have their best interests in mind. A second reason is ethnicity and performance. This can be seen through patient-provider concordance. This is when a patient and provider share similar social characteristics, such as, beliefs and experiences, and a number of studies have found that concordance was positively associated with high ratings in patient satisfaction. And a lot of patients have felt like they had a better health outcome with a provider that was more like them than a provider that was not. A third reason is the need to address past discrimination. As mentioned earlier, it is important to address the past because in some groups there may have been bad experiences, and it is important to acknowledge some of these groups because they might feel hesitant to accept certain providers because of that past experience, especially with the idea of health inequity, where historically some groups have not been giving adequate health care because of their race and income difference. This causes many to lean toward providers who they feel will not treat them the way many others have been treated. And the last reason is emotional factors. Emotional factors are also important because if a patient feels distressed or uncomfortable with the provider, it could impair them from communicating efficiently and openly. And this could also lead the provider to make a wrong diagnosis and could endanger the life of the patient. Allowing the patient to choose might improve outcomes than limiting them to certain providers. So this leads us to two questions. What is one possible reason why a patient might refuse treatment from a doctor of a specific race or ethnicity? A. The doctor is not qualified enough. B. The patient has cultural or personal beliefs that influence their preference. C. The doctor has no experience with medical procedures. And D. The doctor is too young or inexperienced. So the answer would be B, because a patient's cultural and personal beliefs can strongly influence their preference for a provider. And this was spoken about in my earlier slide, especially because a lot of personal beliefs or cultural beliefs that a patient may have will oftentimes make them choose a provider that is more like them, like I had explained with racial concordance, where they feel a lot more better with a provider that is closer to them because they feel like their issues and all their concerns can be communicated openly and be communicated clearly. Two, what is a potential consequence of stereotypes and biases when it comes to healthcare treatment? A. Patients may feel more confident in receiving care from a doctor of a different ethnicity. B. Patients may refuse treatment due to preconceived notions about doctors from certain racial or ethnic backgrounds. C. Healthcare providers will automatically receive more trust from all patients. Or D. It helps patients make informed decisions about their treatment options. So the answer would be B again. So stereotypes and biases can lead patients to form negative notions of their providers